So here's the first cervical vertebra, and it's going to rotate like this. And the skull rotates with it. So as one piece, they rotate around that dens when you do this. Dens means tooth. It always reminds me a little bit of a little tooth that chicks are born with so they can poke through the shell. So that's where that word comes from. Okay? Anybody not have a vertebra or want to see a separate copy? Because it's the second vertebra of your chain. I'll put them over here if you want to take a look at them later. And you won't have your own articulated vertebral column. Now, on this one, you can see another characteristic that's present on 5 of the 7. Okay, do you see something else up on here? Look at the ones that are on your own vertebral column. What you see that's present on a few. It's not present on the first one, and it's not present on the last cervical vertebra. See how this doesn't quite fuse? So on cervical vertebra 2, 3, 4, 5, and 6, they have this bifid spinous process where the two lamina didn't completely fuse. Bifid, same word for bifida, spinous process. And then finally, the third unique cervical vertebra is number 7. So we had a special name for number 1, the atlas, special name for number 2, the axis, and number 7 has a long process. So on this diagram, you can see that this bifid spinous process is found here in the axis, the 3rd, 4th, 5th, and 6th. The 7th one does not have a bifid, but its spinous process sticks out farther than any other. So if you put your hand at the base of your neck, most of you will be able to feel a bump right there. That's your 7th cervical vertebra. And it's called a vertebral prominence, or the prominent vertebra. And it's because its spinous process extends out so far. So the entire vertebra is a vertebral prominence. Okay. Now just in general, not something that shows up as clearly with a single vertebra, is the pattern. Notice how horizontal these spinous processes are? When we compare that to the thoracic spinous processes, these are much more vertical and overlapping. So they're like shingles. So, not that I recommend it. Shoot, you have me on recording. Oh well, I guess I'll go through with it. If you were to go after somebody with an ice pick, you're much more likely to get to their spinal cord between the spinous processes of the cervical vertebra than you are the thoracic, because of that overlapping protection. Okay? Whereas so in thoracic it's like this, in cervical it's like that. That's a little easier to get between them. All right. But I didn't recommend it to anybody. Okay? I'm not saying go try this out.
You're saying we shouldn't do that.
Correct. Okay, so now let's look at thoracic. We have 12 thoracic vertebrae. Notice how the bodies are getting bigger, getting thicker because they're supporting more weight. In addition, thoracic vertebrae have 6 more additional articulating surfaces. We go back to the original, let's see if I have it here. No, the original typical vertebra picture was better to demonstrate that. So 6 additional articulating surfaces. I can't draw all of them on the board because they're going to be on the 3 of them are going to be on the other side. But there's one here, and one here. What do you think those are for? We talked about it. I think you mentioned the rib. The ribs. Okay. So these are called costal facet, costal for the word rib. And the reason we have, this is just a partial one, so it's known as a demifacet, because because in actuality, the head of the rib is against both vertebrae. So if my fist is the head of the rib, it's going to fit in here like this. And then the tubercle is going to come out and articulate with the transverse process. Okay. So let me illustrate that by skipping ahead a bit. There. So here's the head of the rib, articulating on a dim facet of the body, and then the tubercle articulates on the transverse process. So head to body, T to T, tubercle to transverse. And we'll look at this when we do the rib again. But on this view, you can see how the head is between two vertebrae. And so we have a partial costal facet here, a partial costal facet here, and the two together form an articulation for one rib. So that's why we have 6. 1, 2, 3, and then we repeat it on the opposite side. So we identify a thoracic vertebra. First of all, we look for that transverse foramen, okay? So in the thoracic vertebra, that's going to be absent. So the absence of transverse foramina and the presence of the costal facets, the rib articulating surface. Okay, and then the spinous processes are longer, narrow, and more vertical. But the 7th cervical vertebra, its spinous process is going to look very similar to the 1st thoracic. Okay? And the 12th thoracic vertebra, its spinous process is going to look very similar to the 1st lumbar. So that's difficult to go just by this. These are much more clear and determinate. So the 12th thoracic vertebra is going to have an articulation surface just at its top, not its bottom, because there is no rib between the 12th thoracic and the 1st lumbar. Okay, so we just use the top portion there. All right, now let's move to the lumbar vertebra, and again, you can see that the bodies are even thicker. Some of them, these are real bones again, and some of them are osteoporotic, and you can start to think of look like they've like a cupcake that's overflown, it's or a muffin that's overbaked its little tin, and they start to have edges that flow over. Some of them will even fuse with the vertebra below. And again, this is because of the greater weight that they need to support. They have, notice how the intervertebral disc is thin in the back and thicker in the front because of that angle that the vertebrae are at. All right. No clear identifying marks on the lumbar vertebra. We go by the absence. All right? So the lumbar vertebra can be identified by the absence of the transverse foramina and by the absence of costal facets. So again, if I have an image of a vertebra and I ask you to classify what group it belongs to, you need to, first of all, look for that transverse foramen. If it's absent, look for the costal facet. If it's absent, then it's going to be a lumbar vertebra. Again, the spinous processes are slightly different. All right, so can I erase this diagram right here? So if I were to draw a comparison of the three, illustrating the differences. Typical spinous processes would be horizontal, but still rather thin. Okay. Thoracic spinous processes, characteristically, would be vertical, but relatively thin, maybe a little bit thicker than that. And lumbar spinous processes are going to be horizontal but wide. Okay. So this is a lumbar vertebra. See how its process is wide instead of tapering? It's kind of not chunky and thick, but just it has this wide rather than tapering down. It's lumbar. And double check to make sure it's not a lumbar that's thoracic that's close to lumbar, so you'd look here and here for a costal facet. Okay, any questions on the lumbar? Here you can see again the spinous process is wide, short. And then that brings us to the sacrum. Okay, so the articulated vertebra have the sacrum attached, or you can get separate ones over there on the counter. And these are 5 sacral vertebrae that have fused. They will still have the intervertebral discs. So here is the anterior surface. And if you look at the anterior surface, you can see a line of cartilage between each of the bodies. And that's the fibrocartilage of the intervertebral disc. It's fused, covered slightly with bone, and fused in that area. So on this side, I'm going to draw the anterior view. And so this would be the body of the first sacral vertebra. If we look at it in a lateral view, it sticks out even more than all the rest. And this is before ultrasound was done on a more common aspect. This is one of the obstetric landmarks when an obstetrician is trying to determine if a woman's pelvic cavity is large enough for the baby's head to pass through. And so this is known as the sacral, just this part of it is known as the sacral promontory. And that belongs to the first sacral vertebra. And then these are transverse lines. And they are the intervertebral discs, covered by a thin shell of bone. That's why they didn't disappear when the bone was being processed. And then we have openings on either side for the spinal nerves. Okay. These sacral spinal nerves are going to form your sciatic nerve, if you've ever heard of that. It travels down your posterior thigh. Some of those will pass anteriorly and go to your pelvic organs. So in this view, these are known as the anterior sacral foramen, or foramina. When we look at the posterior view, we change the name to posterior, but still the same hole. So when I gave the lab exam last week at Sac State, I tagged the posterior, but I didn't take off if they didn't put posterior. I just gave them an extra quarter point if they did. Kind of like we did on our lab exam for some of those components. Okay. this in when I draw the posterior view. All right, so now let's turn it over. The posterior view is much more rough because in the vertebra, that's where we have most of our processes, is the posterior lateral aspect of it. Here on the posterior aspect, posterior to the body, you can see a continuation of the vertebral canal. And in the sacrum, that's known as the sacral canal. And it passes all the way through the sacrum and ends at an opening at the inferior aspect of the sacrum known as the sacral hiatus. So it doesn't contain spinal cord because our spinal cord stops at about L1, L2, but it does contain spinal nerves, okay, that keep coming down, passing through that. Now, these are fused vertebrae, but we still have remnants of the spinous processes. So the most posterior process of the vertebra is the spinous process. So this irregular ridge that you see right in the midline of the sacrum is known as the median sacral crest. And again, that's formed of the spinous processes of the sacral vertebra. And then we would have our posterior sacral foramina. For spinal nerves. And then lateral to that, we have a smaller irregular ridge. And this is from the transverse processes, called the lateral sacral crest. Almost done. Finally, on the lateral surface, you'll see a smooth area, kind of oval triangle in shape. And this is where the sacrum articulates with the pelvis. Because to complete the pelvic girdle, those bones articulate with sacrum. Okay, like that. And so that articulation surface actually has the same name on both the pelvic bones and on the sacrum. And it's named after, it looked to somebody like the auricle, A-U-R, not O-R, auricle of the ear flap. And so this is known as the auricular surface. It sounds like articular, and it is a site of articulation, but it's the auricular surface or fossa. Joint. Okay. So it's just this area right here and here on the lateral aspect. So 5 sacral bones are fused to form, so median sacral crest, lateral sacral crest, sacral hiatus, if that was difficult to see on the diagram. Yes?
So the auricular surface connects to the pelvic bone? Is that what you're saying?
So on the pelvis, we have a very similar shape. You can see the edge of it right here. And the surface on the pelvis is also known as auricular. So we'll talk about that on Thursday. Oh, since I have it here, you can see this happens to be a male. I don't think he ever gave birth. But you can see the sacral promontory. And so the measurement, the obstetrician would put a finger in the vagina up and touch that aspect there and make an estimate as to the length of that. And in the male, again, we'll talk about this on Thursday, but in the male, the pelvis is tilted much farther forward. And these bony processes here are more inward than outward. That's a pretty tiny baby's head to have to go through there. So in the female, those are more oriented this way, and this is flatter out that way to create a larger amount of space. And then finally, the coccyx, or the coccygeal bones, are 3 to 4 fused bones that are attached to the distal end, inferior end of the sacrum. And they don't have nerves that pass through them. There's no canal, vertebral canal for them. Some fuse, and they're hard to tell whether they're separate. They always remind me of like I said, a rattlesnake's tail, because we don't add on tail bones as we get older. All right, so the vertebrae are joined together by ligaments. And can I erase what I have here on the board? So we have the joints between the superior and inferior articulating surfaces. Those are synovial joints, but we also have joints